A part of the motivation for discussing this is because it is something that shows up so commonly in the therapy room. And also from an institutional standpoint and from a cultural standpoint right now, there's a lot of conflict between groups of people, between families, between neighbors for that matter, and coworkers around ideas that people are kind of feeling like, man, like it seems like some people just don't get it, or some people just don't want to get it, or like that they have no understanding or empathy for the experiences of other people. And I want to offer to you that oftentimes when you encounter these kinds of interactions with people, it is true that some people just do not want to understand. Some people just do not have any interest in empathizing or understanding the experiences of others. But some people truly do have a neurochemical imbalance, and they truly do have narcissistic personality disorder, which does not allow them to understand or connect with and relate with other people's experiences in a way that is meaningful or sustainable over time. So I'd like to start by talking with you a bit about what are some of the common characteristics and features of people that display a lot of narcissism. And I want to say people that display narcissism or people that have narcissistic personality disorder, because I'd rather frame it in that way instead of calling them just narcissists. Because, you know, narcissism truly is a mental health issue. And in the same way that I wouldn't call someone a human being borderline, or that person is just manic, or that person is bipolar, or that person is anxiety disorder, or that person is obsessive compulsive disorder. I'm just giving some examples. You are not your diagnosis. You are not your disorder. You have this, or you're managing this, or maybe it has gone undiagnosed, but that's not who you are at your core. So I don't like to call people, like label them as like that person is a narcissist, or that person, you know, is an abuser. Now that person may have abused for sure. That person may have a lot of narcissism or have the personality disorder. And that person may be struggling with depression for sure. That person may have a lot of anxiety or anxiety disorder, but it doesn't mean that that's who they are. And a lot of times shame from stigmatization further escalates the maladaptive behaviors and maladaptive thinking of folks that are struggling with mental illness. So it's really important that we don't label each other as our mental health diagnosis. I think that's important to say before we start the conversation. So here are 7 specific traits of narcissism. Okay. So in terms of narcissistic personality disorder, or NPD, we can define it as narcissistic personality disorder. It is defined by a pattern of self-centered, arrogant thinking and behavior. So a pattern of self-centered, arrogant thinking and behavior, a lack of empathy and consideration for other people, and an excessive need for admiration and for praise. People that typically have NPD are often described as cocky, manipulative, selfish, patronizing, and demanding. And this way of thinking and behaving surfaces in pretty much every area of a person that has narcissistic personality disorders life, from love to family relationships to working relationships. So number 1 is grandiose sense of self-importance. So it's more than just arrogance. It's more than just vanity. It is a sense of self-importance that is inflated and unrealistic and is needed in order to feel superior. This is the person that everywhere you go, it seems like they're talking about themselves. Every conversation that you have somehow leads back to something that they're doing or that they're going to do. And they tend to gas up the things that they have accomplished and done. It's kind of like you can't always put your finger on it. Like, wait, did you really do that? Or I remember back in the 90s, there was a show called Martin, and I think there was a character's name Tommy, and everyone would always be like, what do you do, Tommy? Like, no one ever really knew what he did. So sometimes it comes with these vague but also very grandiose descriptions of their lives and their accomplishments. Narcissistic people, or people that display narcissism rather, typically believe that they're better than everyone else, and they expect recognition. even when they've done nothing to earn it. So grandiose sense of self-importance is the first. The second is that a person with narcissism lives in a fantasy world that supports their delusions of grandeur. And so, they spin off of glorifying fantasies about success and love and power and attractiveness. And they tend to surround themselves with people in this bubble that will tolerate it and not call them out for it, or that will perpetuate it and support it. People with a lot of narcissism, though, they tend to suck the life out of everyone around them. They almost leave the people around them kind of speechless and energyless, like energy vampires, because they feed off of, and they need the energy, they need the praise, they need the acceptance of other people in order for them to feel okay. But because it's an addictive behavioral pattern, it never ends up really being quite enough. It's like they're looking for that next fix or that next hit through conversations and through interactions with people that will buy into their ideas of delusion and grandeur. Number 3, they need constant praise and admiration. And so people with narcissistic personality disorder typically they have a sense of superiority, but it continues to inflate like a balloon, and it starts to lose air. The air starts to stream away if they're not getting a constant, steady stream of praise from other people. So they'll purposely throw stuff out there and say things that they've done or that they're doing it that they want to do, so they can keep getting this praise over and over again to keep this balloon inflated. And oftentimes, if they do something for other people, it's so that they can get it back. And sometimes they feel very wounded. It's like a wound to their narcissistic ego if somebody doesn't do something back. It's like tit for tat. It's like, I did this for you, so you need to do this for me in this exact way. It's done with the intention of retribution or repayment or entitlement. Number 4, they tend to exploit other people without guilt or shame. And we see narcissistic actual abuse oftentimes with parents, where there is a mother that is absolutely entitled. She feels that she should be able to get what she wants when she wants it. She feels that she should be able to talk to her children how she wants without any explanation and without apology. And if the child even begins to try and express their feelings about something, typically that child is shut down immediately, because the parent has that narcissistic personality disorder where they don't have any room or any space for other people's feelings. One of their ways of coping with life and coping with trauma has been to cut off emotion and cut off connection. So they walk around more so almost like a hollow person or a hollow shell of a person, a caricature, but there's nothing in there on the inside with depth that they're willing or able to get in touch with to display to others. It's not that it doesn't exist, but they're not able to access those emotions. If you remember in our last segment about post-traumatic stress disorder and how part of it can be little or no memories or a sense of numbness or a sense of detachment and disconnection. Oftentimes people that have narcissistic personality disorder have experienced tremendous trauma or a tremendous traumatic experience in their life. And instead of them going inward into their feelings to process them, to deal with them, to identify them, and to heal them, they completely detach from them and cut them off altogether. So it's absolutely a coping mechanism, and more often than not, around trauma, and very specifically around attachment trauma with caregivers growing up when their needs were not met, or when they had a traumatic experience or a series of multiple incident traumas with caregivers. They cut off and shut off that part of themselves and said, look, this is too much for me to cope and deal. I'll never feel this way again. So I'm going to cut this off and become cold and dismissive and divisive and non-empathetic. And I need to win at all costs so I can never be in this victimized or vulnerable state again. Okay. Also, folks with NPD frequently will demean, intimidate, or bully or belittle others. Sometimes you find this showing up in the conversation as condescending comments, like little jabs or microaggressions. They may not necessarily directly be bullying or directly be verbally abusive to the person, but they tend to be very sarcastic and very shaming. And so when the person walks away, they tend to feel very disempowered again, because of the conversation with the narcissistic person. But they can't always put their finger on it, because usually a person with NPD will not acknowledge any time that they have done wrong. They know how to always flip it back on the other person. Well, it's because you you did this, or you're being too sensitive, or you're overthinking it, or I didn't see it that way, you just don't understand how much I care about you. It's like they're going to gaslight you and gaslight you and gaslight you so that you do not acknowledge or have ownership of your own feelings, your experience. And the purpose of gaslighting is so that you can question your reality. That's what gaslighting is for. It's to keep coercing and pushing somebody and distorting their sense of self so that they begin to question their own reality and their own experience. Okay. And then number 5, we talked a little bit about this, but this idea and this concept of lacking any sort of emotional range. A lot of times people with narcissistic personality disorder, they know how to feign or how to pretend to feel, or they know how to, like imitate or mirror somebody else's kindness, but they really don't have it where they can source it from themselves on their own. A lot of times people with NPD tend to mirror other people over and over again because they have an intimacy disorder where they're not able to create intimate and vulnerable and connecting interactions with people on the long term. They can pretend, they can put on the act, but it's like, again, that empty shell. You can't ever get to the bottom of it or get to the foundation of it because the foundation is not there. And then one of the things that typically makes people susceptible to narcissistic abuse or narcissistic relationships is a person that's very codependent. So let's talk about that. Codependency, or a self-love disorder or self-love deficit, shows up when your entire external identity and sense of value comes from what you can do for others and what you can be to others. And really, when we have the self-love deficiency, we don't feel valuable within ourselves on our own, and we typically will fear so greatly that we will be left alone. So we find ourselves putting ourselves in relationships with other people that have this narcissism that will suck the life out of you, but then on the other end of it, you won't ever set the boundary to walk away from it. Or if you do, oftentimes it's way down the road because there's this really deep fear that you're going to be left alone or that you're not lovable. And so in terms of healing from narcissistic personality disorder and healing from codependency, because the narcissist needs a codependent and the codependent needs a narcissist, it works together like a yin and a yang. And so in terms of healing that, absolutely good quality comprehensive therapeutic care, but also beginning to learn how to set boundaries, how to begin to learn how to stick and stay with those boundaries consistently over time. And then it's like a love detox, realizing that you have to reposition yourself in your friendships, in your relationships with your coworkers and with other people, so that you are not always in a position of being codependent, where there's an imbalance of power or where there's an imbalance of energy that's put into the relationship. Now, for somebody that's listening to this and says, gosh, I can relate to a lot of these things about narcissistic personality disorder, you don't have to try and self-assess. Reach out to a qualified mental health professional through NAMI or through Mental Health Match or through Psychology Today. You can sit down with someone and actually get a full clinical assessment. And in the meantime, you can know that you too can heal from NPD as well. It's going to take a lot of humility. It's going to take a lot of journaling. It's going to take a lot of inner work and self-work. It's going to take a lot of vulnerability and transparency, so that when you go into the therapy room, you don't then go in trying to put on a show for the therapist and get nothing done. So, I think for a lot of people that have narcissistic personality disorder, they tend to start to run into so many relationship problems that they get to a point where they say, look, I don't have anything to lose. I have to deal with this. I have to heal. And it becomes exhausting, because keeping up with those delusions of grandeur, keeping up with, the inflated sense of self and always wanting more praise, always wanting more accolades from other people, that is an exhausting kind of way to live. And it really does become tiresome, and it leads to a lot of burnout and sometimes even bitterness from the folks that are struggling with this particular way of thinking and pattern behavior. So if you are having a conversation with someone and they are not seeing your perspective, they're not seeing your point of view, I want you to know it is not your job and your responsibility to re-educate the world on your perspective. You can hold true to your values, your beliefs, and your experiences without having to have someone else validate it in order to make them true and in order to make them meaningful. The other part of that is to know that for some people, and the same way that some people are triggered greatly through post-traumatic stress disorder symptoms with hypervigilance and with irritability and with flashbacks, some people are also triggered with post-traumatic stress disorder in the sense of having no memories or little memories, or a detachment from reality, or a sense of numbness. So if you run into conversations with folks like that, I would suggest that you consider having the same level of empathy that you have for the person that is very verbose and emoting a lot as a way of displaying their response to trauma. Having that same kind of compassion and empathy for a person that is very shut down and very numb and very callous and very cold, and realizing that that too is a coping mechanism. And it's not your job to fix it, and it's not your job to heal it. Your job is to do your work, because it is true that we cannot control the thoughts, behaviors, opinions, feelings, and actions of other people, but it is absolutely our responsibility to manage and control our reactions, our thoughts, our behaviors, our values, and our beliefs. And when we do that, we take back the power into our own hands of our experience, instead of giving it away to someone else for someone else's approval. So if anything in this resonated with you, please feel free to like, comment, or share. And I look forward to seeing you out on NPR Radio or CBS here in Austin, or on my podcast, or on the Instagram page. Listen, be kind to yourself and to those around you. I look forward to seeing you next time. Namaste.